The Minneapolis City Council is gearing up for a big vote on raising the minimum wage to $15 an hour. Council members will get a final look at the ordinance at a meeting this morning. Supporters of the pay hike say this will help thousands of people get and stay out of poverty. The city's own study found that the pay hike would impact 48% of workers in Minneapolis, about 150,000 people. But not all businesses and employees are on board. Some spoke before the city council last week and said the hike, especially for tipped workers, would mean jacking up the prices of services or cutting the numbers of workers they can afford to keep on. For now, it's a tentative plan to raise the wage, and this is how it will work. It's a 5-year process. Large businesses with more than 100 workers would front-end load higher pay hikes early. So this is how the bigger business, this is how the smaller businesses it will work out. If you have fewer than 100 workers, you could raise wages a little more slowly. But everyone in Minneapolis would be at that $15 an hour mark by 2022.
Senate Republicans are forced to take a step back and regroup on overhauling health care. Senate Majority Leader Mitch McConnell and chief author of the bill postponed a key vote because he doesn't have enough support from members of his own party. He met with the president at the White House yesterday to discuss the next steps.
I had hoped, as you know, that we could have gotten to the floor this week, but we're not quite there. But I think we've got a really good chance of getting there. It'll just take us a little bit longer.
The big sticking points for opponents on both sides of the aisle: reduced support for Medicaid and for Planned Parenthood. Another concern, the Congressional Budget Office's report that projects 22 million more Americans would find themselves uninsured by 2026. If Republican leaders end up rewriting the bill, that would then need to be reevaluated by the CBO, a process that could take several weeks.
WCCO chief political reporter Pat Kessler joins us now. And Pat, a lot of the reporting on this has made it sound that everyone's upset about the CBO score. But really, a lot of the Republicans who are upset want bigger cuts. It's not that they're upset about 22 million.
Well, yeah, it's really interesting because you've got conservatives who want more cuts, and then you have the more moderate Republicans who want fewer cuts and want more help with the states. So I don't know how they put all of those together. Mitch McConnell is supposed to be a tremendous deal maker and a tremendous tactician, but he hasn't been able to quite put this together yet. And President Trump, I check every morning before we come on to make sure that he's tweeting again, of course, about this. And he says some of the fake news media likes to say I am not totally engaged in health care. Wrong.
There it is.
Sad. So they're going to move past July 4th. They have to figure out a way to do this. But
so how do they do that? Like, if you're in the Republican Party and you've got people in your own party who are saying this isn't enough, but you can't get any of the Democrats on board because it's too far. What do you do?
It might actually happen that the Democrats are going to have to work with the Republicans and put something together. They might need Democratic votes in order to pass. Remember, this went through many, many hearings. It went through almost a year, went through 70 hearings, many town halls when President Obama pushed this through. This they're trying to do in 1 week. This is going to be really difficult for them. But remember, there's a Republican House, there is a Republican Senate, there is a Republican president, and there's a conservative U.S. Supreme Court. Why they can't get this through is really interesting and probably alarming.
We've seen it in Minnesota. Single party doesn't necessarily mean single mind on these issues.
But they're in control of everything.
Yeah. Let's talk about minimum wage. Yeah. New study that's getting a lot of attention from Seattle. Yeah. They went to $15 an hour. They're kind of on the way, just similar to what Minneapolis is talking about doing. But what they found, at least early in Seattle, is that workers are getting fewer hours on the job, and they're ending up with a net pay loss.
Which is what the opponents of this minimum wage hike are saying. Now, it's important to point out that this study, this research study in Seattle, has not been peer-reviewed, meaning that other scientists have not had a chance to look at it yet. And there are some questions about the methods, the methodology of this. But in effect, it says if you increase up to $15 an hour, which is pretty high, would be the highest in the country in Seattle, it means that there will be fewer jobs and lower wages available. I think the people in Minneapolis, Minneapolis City Council, are taking a really close look at this because that is a warning signal that maybe you want to move more slowly, go up a little lower, whatever it is.
Or get a little more research, too, on exactly what this means.
But this thing's rolling. This thing is going right now.
Okay. Thanks, Pat.
Thank you.